Is foot and ankle pain holding you back? Well, what if I told you there's one brace that can treat many different foot and ankle conditions? Well, that brace is the ASO brace, and in my practice as a podiatrist, I use it for a multitude of different foot and ankle problems that has worked wonderfully for, and I even use it for my own ankle problems. And in this video, I'm going to share 5 key conditions that an ASO ankle brace treats very effectively, and the 5th one may surprise you. The secret to the brace's success is how it's applied. I'm going to show you exactly how to put it on and the different tricks I use to treat the different conditions we're going to talk about. And what makes this brace even better is that it's very affordable and it's accessible. You can buy it on Amazon and you can use your HSA and your FSA to pay for it. Hey everybody, it's Dr. Gaffney, saving you time and money in your foot and ankle health decisions. So this is the DonJoy version of the ASO brace, and as you can see, it's a lace-up brace here, and there is a top and a bottom. A lot of people put it on backward, so the taller part goes up your leg, and it kind of is lace-up like a boot. And it has these long little straps, and these are the money straps. These go around the foot and ankle in a figure of 8, and that's what does all the magic. So how you put it on is just like a boot there. There's a little hole there for your heel as well. So you gotta make sure the tall part's up into your leg, and you gotta wear a tall sock that goes above the brace so it doesn't irritate, the edge of the brace doesn't irritate your leg. And then you gotta make the tongue nice and flat so it doesn't fold up and irritate. So if you're using this for an ankle sprain, you just kind of lace this up really snug. And that's the first use of this ASO brace. It's the original most popular use for the ASO brace is an ankle sprain, after an ankle sprain. So you just have to make sure your heel's down in this little hole here. And then just pull it up nice and snug. And there are different sizes, so you measure your ankle and determine the proper size that you need to get. The only type of ankle that this does not work for is if you have a really big calf and a really small ankle. It's not going to work because you need the surface area contact for it to be helpful for you. Make sure it's nice and snug. That's one of the keys for the success of the ASO brace. And then you can see that the sock is up above this edge because this edge cuts in and can be bothersome. And then you just tie it like this and double knot it. Okay, so these straps here, these are important. So if you have a lateral ankle sprain, so the sprain on the outside of your ankle, you put this strap on first, and it goes around like a figure 8 around the side here and then up, and this is all Velcro. You pull it a little bit snug, and like that it stays. And then this is your money strap here for a lateral ankle sprain, and you just come around the front like this, and then you pull it. You got a little tab to pull it. You pull it up underneath your arch on the lateral side, and you want to really pull this snug so your foot's kind of everted outward. And this will take all the strain off of ankle ligaments. This kind of mimics your anatomical alignment of your lateral ankle ligaments, and that's why it works so well for an ankle sprain. And then this just holds everything in place right here. So the first use of the ASO brace, like we talked about, is the lateral ankle sprain. And so the important part when you're putting this on is this strap to go up laterally real tight. Wish I had this brace in high school when I was spraining my ankle playing volleyball. And in the late 80s, when I first started playing volleyball, I've been playing volleyball for over 40 years, high school and college. But in the late 80s, we did not have braces like this. So my coach would strap my ankle, and we did not have he did not use pre-tapes. So essentially when you took off your strapping, I was like peeling off my skin. So that was torture. But so that's why I'm so thankful that we have this brace. So personally, I've sprained my ankle a multitude of times playing volleyball, usually like every other year. But in the last like 7 to 8 years, I've been doing yoga on a regular basis, and I have not had any ankle sprains. So that's kind of a cheap physical therapy type rehab, is doing yoga, and yoga will help your position sense and help your muscle strength and your position in space, so you be less likely to have an ankle sprain. The second use of the ASO brace is for a posterior tibial tendonitis. So posterior tibial tendonitis is just tendonitis of that tendon on the inside of your ankle there, and that can happen when you have a flat foot, an overly flat foot, and that tendon's starting to work too hard and it can get strained, or if you're not wearing shoes that are supportive enough. So when you wear your ASO brace to help with that, what you do is you first put the lateral strap on first, which is this one, the outside strap. So you take it around the outside and you just do a little bit of tension there, not too much. We want to support this side, so this strap is your money strap, and then you put it around and outside, and then you pull this up really, really tight, and that'll take the strain off of that posterior tibial tendon on the inside of your ankle there. So the third condition that you can use the ASO brace for is a peroneal tendonitis. And your peroneal tendons run on the outside of your ankle here. So if you have like a high arch foot, this sometimes gets strained and you can get tendonitis. And usually when I use this brace for tendonitis, it's a real mild tendonitis, or you're recovering from a tendonitis. And you have to check with your doctor to make sure that you can use this brace, and also follow the treatment plan of your doctor. But anyway, for the peroneal tendonitis, you put this medial strap on first, just minimal tension here, the one that goes on the inside of the ankle. And then the lateral strap, this is your money strap, and you go around the arch and then you pull it up nice and snug so your foot's everted, and it'll take the stress off of those peroneal tendons, and then snap it all together so that the posterior tibial tendon and the peroneal tendons operate on each side of the joint there. So it's almost like reins of a horse. And so for your posterior tibial tendonitis and the peroneal tendonitis, you can wear this brace inside a sneaker. And I usually recommend that to my patients. So a good cross-trainer sneaker with a solid heel counter and a flared heel, and that'll support it really well. Okay, so the fourth condition that I use this brace for is for a mild Achilles tendonitis. So you don't really pull it too much one way or the other. You just want even tension on both sides. And so you just make sure, again, it's nice and snug, and you pull the strap around your ankle and then up the side, and then even tension both sides. And then this way too. And you just want to make sure it limits up and down motion. So you still have a little bit of up and down motion with this brace, but it does help quite a bit. And I've used this myself recovering from a partial Achilles tendon tear, again, after a volleyball injury. So after I was done with my cam boot, I wore this for a while. But again, follow your doctor's treatment regimen to be sure you're doing things right. Also, with the Achilles tendonitis, if you wear like a little heel lift in there, that'll also take the strain off the Achilles tendon. So the fifth most surprising way to use an ASO brace is for plantar fasciitis. And I use it for plantar fasciitis when a patient also has a secondary tendonitis, like that peroneal tendonitis or the posterior tibial tendonitis. And that's usually from limping. So how this helps with plantar fasciitis is you do your straps here again, and you normally, wherever you're having the tendonitis with your plantar fasciitis, that's where you want to pull it up tight. But this works well for plantar fasciitis because you can pull these straps up. These straps will lift the plantar fascia and take the strain off of the insertion site at the heel. So you just pull it up like that, and it'll give it a really good support through there, and then also support the tendons at the same time. If you want to learn more about how to resolve plantar fasciitis, please check out my episodes on that. Now, if you ever used an ASO brace, please let me know in the comments what you used it for and what you thought of it. If you've gotten value out of this episode, please like and subscribe. I appreciate that very much, and we'll see you again next time. Thank you so much for watching. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.